Welcome, everybody. We're excited for today's conversation, Building the Bridge, how public health and community development can work together to advance shared health and racial equity goals. So we'll just give it a couple of minutes as folks continue to filter in. I can see the numbers are going up. Welcome, everyone. And in the meantime, while we wait, we invite you to put your name, your location, any kind of institutional affiliation you might have in the chat so we can see who's joining. And as people are joining in, signing in, if you're interested in learning more about cross-sector collaboration and would like to attend future events like this, be sure to sign up for our newsletter that we call The Pulse, and someone's going to drop that link in the chat now too, as everyone's coming in. So welcome. Just give it another 30 seconds or so while everyone settles in. Great to see people all over the country joining. It's always fun to see that coming up in the chat. So welcome, add your name, where you are, where you're joining us from, perhaps your institution. Say hi. Great. Okay, I think we've got a good number in the room already. The numbers are still going up. So we're glad that you can join us today for this webinar, which is part of our series, our Network Commons series. My name is Ruth Thomas-Guance, and I'm the co-executive director at Build Healthy Places. And we're gathered in this virtual space with equity in mind and a focus on community. And I want to acknowledge that I'm speaking to you from San Francisco, the unceded territory of the Ramaytush Ohlone people, the original people of San Francisco Peninsula who've been custodians of this land for generations. And as I continue on with this introduction to our work, again, feel free to type your name, where you are, and your institutional affiliation. And just a quick couple of housekeeping announcements that we have to have before we start. I know we've all been living on Zoom for the past few years, but a quick reminder. So we're going to use the Q&A function today. So you can suggest questions for our speakers and panelists there, and then we'll try and answer some of them live through that little facility there. And then you can also use the chat function for any technical difficulties that you might have, and we'll try and troubleshoot those. We'll also provide resources as we go through, and they'll be showing up in the chat. So welcome. We're excited to welcome you back to this series. And if you haven't come before, and to any first timers, this is a space where we explore topics relevant to multi-sector approaches to improve health equity through facilitated conversations from experts, practitioners, and advocates from across the country. Build Healthy Places Network ourselves, for those who are unfamiliar with our work, we're a national centre with a mission to foster cross-sector collaboration across healthcare, public health, and the community development sector to help accelerate community-centred investments to advance racial equity. And we're a programme of the Public Health Institute in Auckland. So we're going to begin today's webinar grounding ourselves in the power of communication through art. So it's a pleasure to welcome to this space someone who creates art through the spoken word. And Portia Veyu is a spoken word artist based here in Oakland, California. So thank you, Portia, for joining us. And I'm going to hand the mic over to you.
Thank you, Ruth. Good morning, everyone. Thank you for having me. Again, my name is Portia Veyu, aka The Poetic Activist. You can find me on Instagram and all other platforms at The Poetic Activist. This is very important work that is being done here. And as we talk about the importance of advancing racial equity, strengthening communities, and addressing racism as a public health issue, I thought about what to write for today's webinar, and I was very compelled to tell the devastating story of a very influential Black woman and her family who were recent victims of racial disparities weaved into American healthcare. So I do want to preface that this poem may be heavy, but I do hope it speaks to you all, and it just further fuels the fire for us to continue doing the hard and painful work of fighting for racial equity, especially in healthcare, and especially for Black women. So this poem is called "There Are Too Many Jessicas in the Room." It is a beautiful sunny day in California, June 2022. Jessica, aka the most disrespected, unprotected person in America, aka Black woman, holds her stomach with pain in her body and fear in her heart. A sea of red is escaping her and she doesn't know why. In panic, she picks up her phone, asks other women if they'd ever experienced the same. They became choir, singing of similar experiences of pain, leaving Jessica to feel that everything would be okay. It is July 1st, 2022. At 4 in the morning, Jessica's husband finds his bride on the bathroom floor, her breath escaping her, and he doesn't know why. In panic, he picks up his faith, asks God to restore her breathing, and she wakes. After being rushed to the hospital, her white coat and shining armor tells her the blood loss is due to fibroids, a common yet burdensome condition held by more than 80% of Black women, including myself. Though her fibroids had characteristics that suggested something else was wrong, she has sung a lullaby, like mothers sing to their children in time of distress. Shh, you have nothing to worry about, they say. She is told to not be alarmed, that she is not in much harm since fibroids are benign. Jessica goes home in peace to her husband and 2 daughters, thinking life is just fine, not knowing that soon she would be back in a hospital bed. It is December 31st, 2022. For months she had not bled, but her stomach was in pain until this day. This day, the Red Sea returned, burned through her insides like a raging fire, not only physically exhausting, but mentally draining. It is January 7th, 2023. Jessica settles into the hospital that would serve as her hotel for the next week. As they examine the fibroid that has turned her life upside down, her white coats and shining armor tell her the blood loss is due to this fibroid, a common yet burdensome condition held by more than 80% of Black women, including myself. She has sung a song resembling that of children singing at the beginning of a horror movie. Only this movie is reality. You have something to worry about, they say, as 10 blood transfusions are served to her on a platter. With lack of blood supply, her fibroid cannot be surgically removed. Her fibroids now had characteristics that had not improved, that suggested something else was wrong. And she'd grown tired of the white coat singing that same old song, so she is sent to get a biopsy. Upon first glance, her new doctor does something Jessica had not seen. She does her job, shows concern and empathy in her voice for a woman who had gone hoarse, trying to tell her white coats and shining armor something is wrong. It is February 2023. Jessica heads to her appointment in oncology, her husband holding one hand and her faith holding the other. After waking from the anesthesia, her oncologist, as if at brunch with friends, cracking a few jokes, burns Jessica's tongue with a diagnosis he so uncarefully served her. Yep, you have stage 3 cervical cancer, he says, no cushion or care in his voice. Jessica takes her mind down memory lane, back to June 2022, to the day she held her stomach with pain in her body and fear in her heart, puts emotional pieces of a scary puzzle together and realizes the sea of red that had escaped her was cancer all along. The lullaby they sang her indeed became a sad song as the hospital became her second home. Weeks of hospital visits, countless conversations with God, 18 blood transfusions, and a million prayers later, it is July 31st, 2023. Jessica shows her face to the digital world for the first time in 6 months. She paints her horror story in as many characters as Instagram allows, sharing a testimony that sounds all too familiar. Truth in one hand, hope in the other. It is August 5th, 2023. Jessica posts on Instagram that she's gone to visit family in Georgia to enjoy a change of scenery and the beautiful southern sunshine, not knowing she'd be posting for the very last time. It is March 11th, 2024. 2 little Black girls say goodbye to their mother. One lonely Black man says goodbye to his wife. 2 Black parents say goodbye to their daughter. A number of friends say goodbye to their comrade, and millions of followers say goodbye to their inspiration. Jessica Petway's life came to an end after the fibroid, aka cervical cancer, aka the Red Sea, finally swept her away. ending a life that could have been saved if white coats and shining armor had simply just listened. See, Jessica is every Black woman, AKA most disrespected, unprotected person in America that has ever gone to receive a checkup and became fed up with the lack of care they were served. Jessica is every Black woman who has deserved more than less of the bare minimum support the system gave her, a system that made her feel unseen and ignored. Jessica is every Black woman who abhors American healthcare, who has canceled their doctor's appointment. Because why waste our gas traveling to a place that won't even take us seriously? Jessica is every Black woman whose voice has gone hoarse from advocating for their health in a system that was built to ignore our wounds. When a country cannot acknowledge its once unrighteous use of Black women as lab rats to practice on, to deem capable of having a magically high pain tolerance, to scoff at our physical distress, to ignore our cries and pleas for help, to diminish or shame our concerns about health, it will continue to kill, to destroy, to steal, to rob us of our smiles and life expectancy, to leave us feeling helpless and forgotten and abused. There are too many Jessicas in the room, too many Jessicas in the tomb, with headstones that read, "Gone too soon," on graves created by a world that does not value our lives. It is March 29th, 2024. Black women still hold their stomachs with pain in our bodies and fear in our hearts, frightened that our wounds from a place that is supposed to heal, that is supposed to steal our minds in the most stressful times of our lives, will breed more of the same testimonies from future Black women. Black women who will be given painkillers, side eyes and half smiles, ears that will never truly listen to what we need. Jessica never got what she needed. And had somebody heeded her words when she pleaded, she may still be here. She should still be here. We should still be here. And with all hands on deck to help rebuild the system, we can be. Thank you.
Wow. Thank you so much, Portia, for that. Thank you so much. Give a second, and you can see there's a lot of response in the chat. We appreciate you speaking truths around the unseen and the ignored. Thank you. So we're lucky to have an amazing group of panelists joining us today. And in keeping with it being the last day of Women's History Month, we have a group of women national leaders, which I'm delighted to invite to this space. And I'll just, first I'd like to welcome Robin Taylor, who is the Vice President for the Center for Justice and Public Health at the National Association of Chronic Disease Directors. I'd like to welcome back Melissa Jones, who is the Executive Director at the Bay Area Regional Health Inequities Initiative, BAHI. And finally, I'd also like to welcome Odette McLeish-White, who is the Director of Engagement for the Center for Community Progress. Thank you all for coming again. We're really excited to have you join us here today, and thanks to everyone for joining, watching online. A few weeks ago, Bolt Healthy Places Network was really excited to share a project that we've been working on in partnership with the National Association of Chronic Disease Directors. So we released a public health primer for engaging the community development sector for health equity. And we're sharing the link in the chat in case you want to access that. And the primer was really created as a resource that we really envisaged as a starting point in supporting cross-sector collaboration between public health and community development sector to work mutually in a mutually supportive way to advance health and racial equity. And a challenge to ourselves, I think, to think about who we can partner with in a different way to do this critical and vital work. So we used the vital conditions of health and well-being as a coalescing framework. And that's something that's come out from Rethink Health. And we'll also share that in the chat, but you can also access it through the primer. And that really draws our attention to the drivers of health inequities that sit outside of the doctor's office or clinic. So many of those factors that we know impact those working in the community development sector, such as humane housing, meaningful work and wealth, reliable transportation. And in the spirit of the framework that centers belonging and civic muscle, we emphasize the critical importance for trust building, continued deepening of work that ultimately aims to center community voices and equity, getting back to that unseen and ignored. So for the first question, so this idea of collaboration between these two sectors is not in fact new, we know that, but most of the collaboration between the sectors we see is happening downstream around social needs or social risk factors. And I know Baha'i has a wonderful framework for reducing health inequities that expands our area of impact beyond individuals, given the context in which this work is happening, where the words health equity are triggering and we're getting pushback. Why is the cross-sector and upstream approach so important, Melissa? I'll go to you first, for making health equity a reality.
Thank you, Ruth. Thank you, Ruth, for the question. Really good to be here today. Ruth's right. We have a framework, the Baha'i framework, that's focused on the issues that impact health outside the doctor's office. It's linked here in the chat. It really holds, it's based on the same ideas as the World Health Organization's work on health equity, which is to go to a population scale of creating more health and well-being. We need to be working at the scale of the community conditions that create health. And on the issues like racism, institutional bias, that have created these differences in the living conditions that we find ourselves in. And the living conditions include things like Portia talked about in terms of what our experience is when we go to the doctor. And they include our experiences in housing, economic opportunity, and a range of other factors for health. Now, community development and public health have been working at this for some time. And community development has been working upstream for quite some time. And what the Baha'i framework asks us to do is to plan for the fullness of our human experience. And so to really be planning for what we need socially, economically, in housing, and in services. Yeah.
Yeah, thank you. So, Odetta, from your perspective at the Center for Community Progress, what would you add around this important cross-sector approach in particular to get us closer to health equity?
Thank you so much, Ruth, for adding me to the question for this amazing panel. So the Center for Community Progress is a national nonprofit focused on issues around systemic vacancy, which at one level might seem a little removed from what we're discussing here today. But in fact, when you dig not too far into the idea of why we might have systemic vacancy in certain communities, where it might be entrenched, built upon systemically racist decisions and policies that have placed people in certain places and kept infrastructure and other resources from them, you quickly get to an understanding that what we're really talking about is, the lived environment. Community progress, chooses to focus on vacant land or vacant properties or deteriorating properties. But as some of the links that I will be dropped in to share here kind of outline, there are direct public health impacts of living near and around systemic vacancy. There are individual, both financial and health impacts, psychological impacts of living around vacant property. And we can also think about the solutions, which are going to touch those cross-sector ideas of food access, housing, community development spaces, businesses. All of these things create that enabling environment for health, and not having access to those places in a way that feels comfortable and safe and respectful are part of, we think, the fabric too of supporting equity in health.
Yeah, absolutely. So, Robin, I'll invite you in. So we've had the pleasure of partnering over the production of this primer. Given what Melissa and Odetta have already shared, can you share about why your work and this work on this primer feels really relevant right now, and how this cross-sector collaboration can advance social justice?
Well, thank you for the conversation, and hello, everyone. The primer sets the tone for the conversation to happen between community development corporations and public health. Furthermore, the cross-sector upstream approach to health equity is crucial for making it a reality because it addresses the root causes of health inequities rather than just addressing the symptoms. By collaborating across different sectors, such as housing, education, employment, transportation, organizations can work together to tackle the social determinants of health that contribute to disparities in health outcomes. This approach allows for a more comprehensive and holistic understanding of health inequities because we have the opportunity to exchange information, to set the tone for our conversations together. As it recognizes that health is influenced by a multitude of factors beyond just healthcare. So our health begins in our communities where we live, and who better to partner with than community development corporations? By focusing on upstream interventions together, we can improve access to affordable housing, creating economic opportunities, and promoting educational attainment. Organizations can prevent health inequities before they even occur. Furthermore, collaboration between community development corporations allows for the pooling of resources, expertise, and influence to create a lasting systemic change. By working together, we can leverage our strengths and collectively advocate for policies and initiatives that promote health equity for all communities. So this tool is going to set the stage for conversations to happen on how we can partner together more frequently, consistently, how to open the doors of public health and how to open the doors of community development corporations. This tool sets the stage for that understanding and for future conversations to happen. I believe this tool is a starter for us because there's a lot of work and a lot of opportunities for us to come together to really create rich communities, vibrant communities, thriving communities where people have the things that they need to be healthy. But we have to talk and come together more frequently and intentionally to work together.
Yeah, that's right. Thank you so much. I mean, and something you said sort of really sort of leveraging strengths really sort of leans into something. So one of the questions / comments that we've had from our audience is asked that neither community development nor public health are particularly well resourced. Everybody is always looking for more resources. So what resources can be leveraged to tackle these deep inequities? Where can we leverage strengths? And so what advantage do we have when working together in this way? And Melissa, I'll invite you in. What opportunities do you see around that in terms of deepening our relationships and leveraging strengths that Robin mentioned?
Yeah, thank you. Thank you for that question. So there actually are quite a few what we would call backbone coalitions or community coalitions all across the country that are partnerships of people in communities. They might work at a community development corporation. They might be residents in a neighborhood. They might work at a public health department that have worked on this idea of creating neighborhood plans. And so they have a set of plans of things they want to work on. Often they're exactly in the things that the Bar-High framework focuses on in terms of considering housing needs, considering economic needs, et cetera. And as these groups start to put together these community plans, there's a way to start accessing many different kinds of resources and to support the community that you're working with. Because one of the tricky things, there actually are resources out there. They often are in narrower ways than we would like to see them, right? So often they're not just big chunks of resources that say, you know your community well, do what needs to be done with this really flexible money. That's really what we would like to see, right? We would like to see more and more work where there's trust-based philanthropy that helps that happen, that doesn't force people into boxes. But these community coalitions can then, with their plans, look for the funding streams that work for each project that they have. And that's been really successful in a lot of places. I worked for a number of years at LISC. We ran these kinds of collaborative infrastructure projects all across the country, helping people do everything from build new schools to build new housing, to start entrepreneurship training programs, to invest in local businesses. And so that's really a great way to get things started. There is more money out there than there has been in a long time from government. And so communities that have those organized plans and then a set of priorities that they can take and apply to government resources, that's another place for that. And I think there's, a big role, that's what community can do to have itself organized to bring money in. But there's a really big role for foundations and government to make it easier for communities to do that. Our goal should be to make it feel like rolling a ball downhill, not pushing it uphill. And so for foundations, there's a lot of movement in the field focused on trust-based philanthropy, focused on following the leadership of what communities are prioritizing. And I think more and more as foundations do that, that's really helpful. The other thing we've seen foundations do, like San Francisco Foundation here in the Bay Area, is make public, visible online, how the public resources, the new federal resources that are available are being spent and where they're being dedicated and where they still haven't been allocated. So there's a transparency there, and communities can plan accordingly their own advocacy for resources. And I'd say the thing that government can do is really start to do contracting processes that create more and more access for communities who haven't had it before. Some of the ways we've seen that happen, for example, up in Sonoma County, is you have an initial contract that is provided to an organization, and then subcontracts underneath that go to community partners who hadn't received federal funds before, but get support from that primary organization to manage them. So there are many things that can be done in the foundations and in government to make it easier, and in community to demonstrate need.
Yeah, thank you, Melissa. So we're talking about layering, we're talking about coalition building. Robin, I'll just nip back to you first on what role can state health departments play in this picture? You work at for state chronic disease directors. As we bring public health and community development together, anything you want to add there around how we can then use that to center priorities of communities when we move upstream?
Yes, definitely. State health departments can play a very crucial role in bringing public health and community development corporations together by facilitating partnerships, fostering collaboration, providing resources, information, and data and expertise, right? And advocating for policies that support both sectors working together. You see, a lot of times, and what's really important for community development corporations to understand about public health is that, just as Melissa just discussed, we have a lot of categorical funding, right? And so we can advocate for policies that support both sectors working forward and sustaining those policies so that we can do more together in the future. But one way to center the priorities of communities and upstream solutions is to engage in community-driven planning processes that gather input from local residents, community organizations, and other stakeholders. And when I talk about community organizations, I'm talking about going to those organizations that typically have not been at the table, that really have a grasp and understand the community perspective about challenges and opportunities that are in community. And also other stakeholders to identify and address the most pressing health and development issues in their areas, right? So state health departments can support these efforts by providing data, funding, technical assistance, and guidance to ensure that resulting interventions, those things that we're planning to do, are evidence-based, culturally competent, and responsive to the needs and strengths of the community. Now, in terms of funding, again, state health departments can play a key role in securing and allocating resources for collaborative projects. However, this may involve leveraging existing funding streams, seeking out new sources of funding, advocating for increased investment in upstream approaches, and developing innovative financing mechanisms that support cross-sector partnerships and sustainable outcomes. And one of our states, Rhode Island, has done a really great job at utilizing braided funding mechanisms to support their health equity zones that they have within the state of Rhode Island, and it is working very well. So overall, by fostering partnerships between public health and community development corporations, centering the priorities of communities and upstream solutions, and addressing funding challenges, I believe state health departments can help to advance a more holistic, integrated, and community-centered approach to improving population health and fostering inclusive and equitable development. But again, when we're going into community, I just want to, we're talking about centering the priorities of communities. for community development corporations and public health, I ask that we remember to sustain those relationships with community. I have heard too often from community members that, we can come in and, capture information from community members, get what we need, and then they don't see us again. So it's really important to build trust with community for us, those who are working in public health, as well as community development corporations, so that we can continue to have those partnerships and that bi-directional flow of information to inform the strategies that we're working so hard to place into community.
Absolutely. I think thinking about building that relationship and fostering and maintaining that relationship as a long-term investment rather than just a sort of to the end of one particular project, I think. Odetta, I'll invite you in. So we've heard about centering communities in solutions. Your work focuses on use of land, vacant properties, and anything you can share about that has important ties to community health. So any about power structures, how that plays into this in the work that you do?
Absolutely. Thank you so much. Because community progress is our topic area of vacancy and abandonment and those sort of things really center land. We really are at some of like the root cause or sort of the root spaces, right, where all of these issues are going to be playing out. Grateful for the chance to just bring up power and privilege in all of these discussions, right? Who through a variety of systems, policies, and procedures are allowed to accrue the time, the resourcing, the energy, the knowledge base to kind of confront the things they don't like in their immediate environment, and who through those same policies are able to have leisure, educational attainment, powerful networks that hold where they are in place. Those are actually important dynamics that can play out right at the level of land and home and community. So anywhere where the public health community and certainly the community development corporation community touch where, we're helping to elevate and amplify voices and power that already exist to tackle these things, those are skill sets that are also possible when you're discussing land use. Hey, we really do need we need food access. We want a community garden. Maybe maybe the community is struggling with climate change and stormwater or, disaster preparedness. How can the vacant land that may be around help with that? There are brown fields that need to be repaired and they're often left vacant. What are the strategies that can mitigate for health and avoid health impacts of things like that? When you start talking about land at this level, you're absolutely implicating all of these other types of expertise and impacts, be it public health or the need that community development corporations help to fill. Community Progress has recently published a residence workbook to try and help communities ask different questions. There are actual templates and checklists that groups can go through together to try and educate themselves on what might be at play with the vacant land around them. The hidden power that might be holding a piece of property vacant in a way that doesn't make sense when you think about, well, why doesn't the government just do something about that? Where's my local council person? What if the owner of that land does not even live in your state or your country? How do we find them? How do we activate different systems to get hold of ownership and stewardship of that land again so that it can be repurposed into something healthy and healthful for the community? I did notice in the chat some folks might be having problems with the link, but communityprogress.org is our website. There's a publications tab, and you can go through both reports and publications and blogs that discuss all of this issue. So if you are having a problem linking directly through the chat, I hope you will visit our website and explore some of these things. But the issues of power are so fundamental. Power and privilege is all over these conversations. And it's also very much how we start to push against those in power, keeping the pace keeping pace, serving them. So when a community is ready to push for change and suddenly it's really difficult and why is everything taking so long? But then when the market turns, these invisible landowners are ready to go and things start moving really fast. Those two are dynamics that are reflections of the power and privilege that are at play in these conversations we're having.
Absolutely. Thank you for that, Odetta. And it really sort of speaks to what we often call in the workplace sort of translatable skills, that once we've created these new structures and building power structures within community, that's a sort of a muscle that's being able to flex on multiple issues. So it's a sort of a return on investment across multiple factors that we know are going to impact health. Melissa, did you want to follow up on any of that with the power building? Nope. Oh, sorry.
Yeah, well, I will just say that we have a guide for folks in government. So if you're in government and you're in a power position to think about how to resource communities to do that work that Odetta is talking about, you can go to our report Farther Together. And it creates a way to have not just a one-time contract with a community, but to set up a long-term contract that supports the community in their ongoing community engagement efforts, ongoing work, in a way that helps them have long-term capacity to be in community, doing planning, responding, implementing plans. And that can be one way that in your role for the resources that you have, that you can make an immediate difference and change.
Right.
Yeah.
Yeah, wonderful. Thank you for sharing that. Robin?
Yes, I just wanted to mention that one of the things that I've been working on personally in my role, leveraging my power and privilege, is engaging conversations with my public health colleagues around social justice and public health. And most recently, NACDD released our social justice framework for public health practitioners, which I think that this framework actually supports the primer, right? The primer reinforces what's in our framework, and the framework reinforces the primer. We have 5 pillars that are part of our social justice framework for public health. And guys, this is an introductory framework, so to speak, to level set and provide these 5 pillars that we are hopeful that all public health will be working to operationalize within their local, territorial, county, state health departments. But one of our pillars is prioritizing multidisciplinary partnerships, right? Making sure to bring various disciplines, diverse perspectives to the table, because we don't know everything, right? And because we are government, we're working in government bodies, there's only so much that we can do. But I have experienced where public health has partnered with partners that can do some of the things that we cannot do. We're providing the information, we're providing the data, we're saying, hey, this is what's going on in this community, these are the challenges, these are the assets, and these are the areas that we are like, wow, we need to address these so that we can realize some different health outcomes. And I believe more now than ever is the time for community development corporations, public health, to strengthen their relationship, right? Because we need to work together more than ever because of what we're seeing in the social landscape, what's happening politically, economically in our nation, and the challenges and the multiple forms of oppression that people experience today. It just makes sense. And, I also like to say that I think it's also critically important that we take this very seriously, this opportunity, or seize these opportunities to partner, because sometimes I feel as if we are, doing the same thing over and over and expecting like something different, right? We are going to have to reframe and rethink and go back to our social justice roots of public health, which were around making sure that people have the things that they need to be healthy, right? That's what it's about. And then we've gotten caught up in the public health science, which is great, right? It's great to understand methodology, the science, and all that good stuff. But we also have to remember what's fair, what's just, and what's right, and that we are providing a service. We are wanting to promote optimal health for everyone.
Right. I mean, that's a great point there, Robin. I appreciate you bringing that up, that social justice is a commonality really between the two sectors. You could say the same for community development at its roots, from that idea of creating a space, a living environment in which people get what they need to be able to thrive and be healthy.
And Ruth, we can't do it. I think it's a natural partnership. It's a community development. And where does our health begin? in the places where we live, learn, work, and play, our community. And so it just seems like a natural fit for us to be going in this direction and solidifying those opportunities and our partnership and working together and continuing to share data and information so that we can be precise, strategic, and responsive to community priorities.
Yeah, absolutely. One of the questions that we've had come in was around both the fields, public health and community development, being long-term strategies. And we talked about keeping that momentum going. There's certainly many sort of areas where there's pushback. Any tips on keeping engagement when progress is slower? You know, how do we hold some of those coalitions together? Any thoughts around that?
May I?
Odetta?
Robin, go ahead. Go ahead. No, I want to hear
Go ahead,
Robin. I want
Odetta.
to hear Robin.
No, go ahead, Odetta. It's fine.
Okay. Just very quickly, I think this is where the culture building of coalitions is so important, and really leaning into shared values. You know, Robin, everything you just said was I was just snapping away, because it speaks to the framework of shared values that you could either say it transcends issues or it like undergirds issues, right? So that when things get challenging, or groups that are trying to work together across different disciplinary models or training, a sense of expertise, things like that. If you have a shared framework and a shared goal that is big enough to hold all of that, and a focus on a generative culture within the coalition or the group, that helps you to sort of, keep momentum going during downturns, focus on individual needs, right? Find a way to resource your neighbor to the right and left of you dealing with things as you're working on larger issues. That's the multi-level chess of all of this too, right? At the bottom line are human beings, right? That are always every day waking up and tackling multiple things, right? Whether it's getting your kids to school or getting that land zoned the right way or finding resourcing for projects, right? So how do you help keep the human beings involved, full and doing their restorative practice, like, seeking those shared experiences together so the coalition stays healthy. And I think too, I'll close by saying this, remembering that things like community and solidarity don't always equal perfect agreement, right? And
Yeah.
you won't always like or love everybody that's in solidarity with you. You press on anyway. And that is where, again, that generative coalition or culture, that culture space helps you to either work it out or get to a place where, listen, can't quite agree on that. Here's our big goal. Let's keep going together on that. So that culture and the shared value framework, I think, is part of the way forward on that.
Yeah, great.
The only thing I'd
Melissa?
like to add, Ruth, is that, that backbone organization, making sure you have
Right.
that organization that is supporting the logistics and keeping everything everything going is really important. But I also think that to just piggyback off of Odetta is, with coalitions, you want to make sure that you understand the priorities of the participating organizations and individuals, just as Odetta said, because, for example, we as public health have been accused of going into community with our own priorities and not taking time to understand the priorities of the community. And I've actually been in a community meeting in my public health role, and we come in with our priorities, and we're stating what we think are the root causes of this particular health outcome I'm thinking of. And an elder of the community stood up and said, "Hey, you think that's the reason why we're experiencing this? No, that's not it. Let me tell you what's really going on." And then we were all like, "Whoa, we didn't even think about X, Y, and Z." Yes, you're right. But I think making sure to elevate with the priorities of all the participating members of the coalition will help to keep everybody engaged and excited about being a part of the work.
Right. The members of the coalition and the actual community we're serving. Melissa?
Yeah, I think there can be many reasons a coalition hits a slow moment. Sometimes they're all the way external from you, and sometimes they're internal. Sometimes in a coalition, everybody has generally the same agreement. Everybody is talking about a range of ideas and saying they all seem pretty important, but you don't have the 2 or 3 passionate champions who are going to drive it forward hard. And I think one of the things that can be, or you want everybody to be that, I think one of the things that can be helpful is to allow space in the coalition for groups of 2 or 3 that are really passionate about something that everybody agrees would be a good idea, but not everybody's willing to work on. And then to support those 2 and 3 to keep driving that piece forward, and a different 2 and 3 to be driving something else forward. So you have multiple things moving at the same time, which means when one thing is slow, something else is moving, and you have something to kind of attach to that is going to be your earlier win or your quicker win. And then the other things can move in the time that they take to move. There's another thing too that I believe and that we've been working on at Bar High to help people understand, which is that collaboratives have life cycles. And among that life cycle is the beginning stages when you're building, you've all come together, you all know exactly why you're there, and you're kind of laser focused. And then you have all the changes that happen in a coalition. Somebody moves, somebody switches jobs, all of those things. And it can get fuzzy, or what's happening in the community changes and it gets fuzzy, or it gets more complicated. And then you have this moment where you have to decide, are you in a moment of creative revisioning, or are you in a moment where the time has come to stop and to make room for the next coalition or the next thing? And so there are also ways in which it's useful to have, I think, third parties come in once in a while and talk to the coalition about how has the world changed since you started? And is this the same set of structures, partners, et cetera, that you need for this next body of work? And that becomes, I think, really important when you hit something like the question that was just in the chat about East Boston, which is, there's a lot happening really fast, and it's at a speed that's really hard for a community coalition to respond to. That's a great time to bring in an outside facilitator that says, of all of what's happening, what's most important right now, what's most important in 1 year, and what's the thing that could stun and shock all of us if it moves forward without us focusing on it. And to start to have some strategies that create an urgent moment for the coalition and then help power map who your allies are to help you move some of those things forward. Yeah.
That's fantastic advice. Yeah, thank you, Melissa. And just thinking about that life cycle of a coalition, I love that. So I just wanted to make a quick comment. I can hardly keep up. There's a lot of activity in the chat. Looks like a great conversation that I'd love to visit later. We're missing a whole webinar that's going on there. It's great. And somebody did mention that it's really hard to follow the links because the chat is sort of on fire. We are definitely going to be sharing all the resources in a follow-up email along with the recording of the webinar, just in case anybody's concerned. So building on that, we're talking about leveraging resources. One of the questions that we had was any opportunities around engaging corporate companies in conversations around this work towards racial equity and health equity in particular. Anybody got any insights on that one?
Well, the first thing that comes to mind, Ruth, just speaking from the public health perspective, specifically those folks that are working in government agencies, state, local, county, territorial health departments, there at times there are policies that dictate who our partners could possibly be. That we have policies against lobbying and things of that nature. So it just depends on, the culture of what's happening within that state health department or within that local health department, what their policies are. It's sort of like an if, really. I have heard of public health professionals connecting with corporations, but I think this is something that should be explored more.
Yeah. Anybody else want to take that? We have a ton of questions, but I just wanted to give you the opportunity to chime in.
I'm sure Melissa's also got thoughts about corporations supporting this work. Like they should be in it. They should be interested in healthy communities and healthy employees and healthy neighborhoods where whatever they're offering, be it a service, a website, whatever, that's how thriving starts, right? Again, to kind of drive it down to that. But I have found that the challenge too is helping them to understand how to fund not just the programmatic work and the outputs that you might want to count, but how to fund the work of creating the collaborative, right? That work of setting culture and it's so needed, and it is part of what creates the strength, right? And allows you to go through the life cycle. That was a really great point, Melissa. And so I do think sometimes corporations, I question whether they want to fund some of that culture building work, because that is where power building also happens. And it is much easier to count outputs, which are important when you want to touch people's lives directly. And how do we then challenge corporations and philanthropy in general to fund the processes that bring people together for being directly impacted, knowing that it might very well challenge some power structure, or to rebalance power a little bit. That I think is where folks get a little fearful, and we start to get some of the cycles and practices that are less helpful to deep long-term systemic change.
Right. Thank you, Odetta.
Yeah.
That did come up in, sorry, Melissa, I was just going to say that did come up in one of our questions about how do we move it forward in the civic muscle when it's about changing the status quo, which isn't always a comfort zone for many. So, Melissa.
Yeah, I've approached all of my community coalition work a bit like puzzle pieces. So it's like what the right funder in the right place in the right part of the work. And so the question I think is, who are the right funders to fund your organizing backbone coalition work that are going to be supportive of you having your own voice, your own vision, your own mind? And then what are the ones who are going to be supportive of particular program implementation strategies that fit for them? Often you find with corporations that they're going to be really good in that space. They'll be good in, I want to fund the workforce development program. I want to fund the after school youth program. I want to fund these pieces. And those are actually all important pieces too. They all matter too. And so I think that finding the right place for each funder is really helpful. Same thing for the government funders. What's the right spot for them? And I think that the call to foundations and to others is to be thinking about the spread of their resources, so that there is money for the backbone infrastructure in many places, and so that they're providing their resources in a way too that might encourage that coalition to do some of their own revenue generation or generate some different kinds of services and other things that they might charge for, to have some of their own flexible money to start doing their own organizing or their own lobbying, with a resource that's not bound to anyone else. And so I think when funders are willing to invest in that kind of strategy, it can create a lot of room for communities to have self-determination.
That's great. Thank you. So another question that came up was around, and this is something that we're seeing across sectors in BHPN. How do we work to address racial equity without using the words race or race equity, where that might be closing many years? How are you tackling that in your work? Or how do you see it showing up? Robin? You're on mute, sorry.
Sorry about that. That is a hot topic right now. Let me tell you, in my world and my colleagues that I work with in state chronic disease programs. So right now I find myself in two worlds. I'm working with states that do not have divisive language legislation, and then I'm working with states that do have divisive language legislation. And one thing I've been able to do is leaning back on an old resource that was created by the Robert Wood Johnson Foundation in 2010, but it's still relevant today, maybe even more relevant than it was in 2010. Let me tell you. But what it does is it talks about, how do you talk about health equity and the social determinants of health and all of these things if you're talking to a conservative versus a liberal crowd. And they give examples of keywords and things that you can use and how you reframe the message and saying the same exact thing. So for example, currently right now I'm finishing up a project that I have with a conservative state that I won't mention. At the beginning of our project, the project was to develop some training for the state and their partners to advance health equity, to work together. Well, in the course of between the time we signed our contract and the start of the project, divisive language legislation was passed a couple of years ago. So that meant that all of the content that was developed, the training modules, all of that information had to abide by their legislation and was reviewed by their legal department for every module that was created. But I leveraged that wisdom, that knowledge that I learned from Robert Wood Johnson, and was able to continue to say the same things and do the same work. However, it was frustrating. I will not lie. It was very frustrating, because there were certain things that, oh, I can't use that word. Why can't I use that word? But I continued with the course because I knew what the goal was and why it was so important to do it. But yes, this is a common discussion with our Health Equity Council, with our Racial Equity, Diversity, and Inclusion Alliance is, we're staying alert to these challenges to language and how it is impacting the work that we do at NACDD. I hope that's helpful.
Yeah, thank
Challenging.
you. Odetta, did you have anything you were going to add?
That's such a tough one because you want to be pragmatic and you also want to tell people about themselves.
Exactly.
So there's like a human element to trying to answer that question in a way that's helpful, because it's, you can't ignore the legal obstacles that are being rebuilt. Right. Those are and policy and legislation that's being rebuilt meant to quell and quiet. I think that then probably the easiest way to answer this is, regardless of other people's comfort in discussing race and saying the word race, for the people who are dealing with the impacts, like the upstream on downstream, the downstream folks are dealing with race and they are feeling their intersections, right? Whether they be women, people of color, immigrant, undocumented, you can name them all out, LGBTQIA, young people, unhoused young, all the things, right? So they are not afraid to speak what is their truth and the way that their truth looks. And so if you continue to support their coalition building and their power growth and their health, right? Like finding funders, Melissa, to your point, who will give you funds to let people go on retreat, to take that yoga, like literally making sure that people are okay who are doing this work and impacted directly. They will find speaking up, right? They will be using their courage as they have all along, and maybe that's where we need to, well, that's where I would want to worry. But I'm grateful to know Robin and Melissa and others are also tackling the states who are passing this legislation. So grateful for y'all to be doing that with such pragmatism. And then on the other side, it is the power and the voice sort of rolling up from those who have to say that language, because that is the lived experience of having every day.
And thank you for bringing up self-care, Odetta. That's also such an important part and an act of resistance, as we know, in and of itself, to make sure that we're in it for the long run. So I know we've started talking. I knew we were going to warm up and we could take up the time. So we've tried to get to as many questions as possible. We've just got 3 minutes left. I would just like to ask a lightning round of our panelists. If you would tell someone inspired today, where should they start? What should they think about? They come back on Monday morning. What would your call to action be? And I'll start with you, Melissa.
Sure. I would say find the piece that's in your locus of control right now. Start working on it. Do it the best that you can, and then expand out your influence from there. And when people tell you that everything's changing, there's not room for equity now, remember that there's actually two things happening at the same time. We are seeing all of the work that's been rolling back equity efforts for sure. And we're seeing over 80 jurisdictions across this country begin their planning for Black reparations for health. And so we've seen hundreds of jurisdictions pass racism as a public health crisis work. So both things are happening at once, which means there's opportunity for both at once. And it's an important moment for us to be driving that second part forward.
Thank you for that. Odetta, 1 minute.
I would say to remember that the world we're fighting for actually has never existed. So when you feel despair about that, return to your why, your personal why, and remember that we're still in the act of creation right now. So the work that we're talking about is, you might feel like you're losing ground, but we've actually never been in the place that we say we are envisioning. Therefore, we can keep pressing forward to it. So, and definitely that self-care. Take that nap, read that book, get that massage. For sure.
For me, it's having a great conversation with a wonderful group of women. Robin.
Yes.
Close us out.
Yes, I have 3 words for you, because when I think about why I'm in this space is not about me. It's about the kids. It's about children. I love kids and families. And when I get frustrated in my role or in previous roles, I remember that, there are people that are depending on us, that are in positions where they're not at the table to speak and verbalize what is actually happening in their communities. This work is very intimate and very serious for me because I know there are people who are depending on all of us. So stay steadfast, don't give up, and there will be an evolution of change. I remember earlier in my career at NACDD, we were nowhere near where we are on our journey to racial equity, diversity, and inclusion practices internally and with our work with our members. But it started at one place, and I've stayed steadfast through the different no's, maybe. Oh, okay, yes, now, yeah, we definitely want to do that. So just stay steadfast, don't give up, stay in connect with folks that are doing similar work so you can hear about their strategies. There is the Collaborative for Anti-Racism and Equity that is herenow.org that I'm a part of. I'm a founding member along with a whole lot of other good folks every month we're talking about all things anti-racist practices and strategies, and we're keeping account of the number of local health departments, state health departments that have passed declarations. We are welcome to join, and we also offer peer learning opportunities where we come together and talk all things anti-racism public health practice.
Wonderful. Thank you so much for closing that out. There's a lot of great appreciations in the chat for all of you. I would want to add my voice to that. So thank you to all our panelists and thank you to our audience. We'd really like to hear from our audience to evaluate the webinars. We have a survey that we're going to share. It just takes a couple of minutes to complete. You can get access to it in the link if you catch it before it flies by, but it should also pop up when you leave the Zoom webinar. We'll also be sharing more resources in the coming months on various components of the primer that dive deeper into cross-sector partnerships and can provide organizational guidance and share examples of how these partnerships are established. So I just want to thank everybody. Enjoy the rest of your day. Have a restful and restorative, wonderful weekend. Thank you so much.